So actually my presentations focused on the effect of birth weights on newborn, considering the effect of birth weight on Apgar score, and I've took in consideration other potential risk factors. Actually, it's a cohort study which took place in Brussels. So as a quick overview, we shall look at main 5 points. The ones will be my introductions. I will also share the methodology used, results, discussions, and then we'll go through conclusions. So as an introduction, actually we all know that maternal and the child's health are very critical during pregnancy. And some of the risk factors related to low birth weights include the early pregnancy, which is actually related also to early marriage, previous history of low birth weights among women, the engaging on harmful behaviors such as smoking, excessive alcohol consumptions, having poor nutrition among pregnant and lactating women also influence their future maternity. And the other backgrounds are low for potential socioeconomic status and having other in vitro fertilization treatments. So this study actually took in consideration two categories of low birth weights, some of which is the restricted fetal growth, and the other is the preterms, so which actually needs to be taken into considerations. As statistical review, we actually found that there is a 92% of low birth weights, and among these 92%, we have 70% which are in Asia and 20% in Africa. And when it looked at European countries, we found out that in Southern Europe, they have a low birth weight, which is rated up to 7.5%, while in North and Nordic countries in the Baltic, they have low birth weights at 5%. Actually, Apgar Score, when we try to look at it, Apgar Score, it's a tool which is used actually to measure the newborn activity at birth. So this Apgar Score influence or shows how critical may be the outcome of any newborn related to any neurological future conditions and other developments for the newborn. So my study's objective was actually to explore the associations between parents' characteristics and the birth weights and Apgar score at 1 minute, and the effects of birth weights on Apgar score at 1 minute, considering two potential modifiers. I've took into consideration medical factors and the child's related characteristics at time of delivery. And my methods, which was used, I took into consideration the study designs and settings. So this is actually a cohort study which took place in Brussels, Belgium, and it's actually it's a cohort study which took into consideration the Belgian civil registration systems. So my study populations, I actually considered this all newborns from 1998 up to 2009. And I took also in consideration 1,909 women who delivered at 28 weeks of gestational age and above. Variables that I considered included two outcomes, 13 predictors. And my methodology, as I've said, I considered some of the parents' characteristics which may influence the birth weights, and the same parents' characteristics may also influence on Apgar score. And the other medical interventions and the child-related characteristics like child gender, child gestational age, and child presentations, which may also have another impact on Apgar Score. So my birth weight was categorized in two, and the normal weight was considered as all newborn having 2.5 kgs and above, and low birth weight was considered as all newborn having less than 2.5 kgs at, delivery. And my Apgar score was categorized also into two. All newborn having below 7 Apgar score were scored as depressed newborn, and those having 7 and above as Apgar score were considered to be normal newborns. I will not go through details of all other independent variables which were taken into considerations, but you are having a look at it. There are several. My statistical analysis actually was very well stratified. I want to mention that I've used Stata, which was my statistical software used to analyze this data. And I went through different stages from the descriptions of my variables to invariant analysis of these variables. And from the univariate analysis, I went through multivariate analysis with some stratifications, as I've used to say, and to make sure that my statistical model was actually appropriate, I use Goodnessoffit, which helped me to verify if my model was actually adapted to the data I used. And the non-significant results, it means all p-value for the Goodnessoffit more than 0.05 was considered actually, my model was considered as fitting to this. And other potentials, multicollinearity was also verified to make sure that there is no any variable left out which could have potential factors, interactions during my statistical analysis. Now, as a descriptive studies that I will not actually mention too much, I want to go straight to the univariate analysis of my results. Actually, when I looked at all parents' characteristics, considering the birth weight, I actually found they are all statistically actually significant when you try to look at all the p-value, which are less than 0.01. So all parents' characteristics may have an influence on birth weight. So such main of those parents' characteristics includes medical risk factors. All parents having malnutrition, especially for pregnant women, may have an influence of any birth weight. Women having multiple births have a high risk of producing newborns with a very low birth weight. All gestation age, when looked at babies coming, and when I tried to look at other statistical analysis, when you looked at the parents' characteristic still in now in univariate analysis, when you looked at the Apgar score, so most of them are also statistically significant when you looked at the overall p-value in the area. Now, my multivariate analysis, when I looked at my multivariate analysis, I consider that some of the factors, they are actually statistically significant, especially maternal civil status. You found that among non-married women, they have actually a high chance of having newborn with a very low birth weight, which may have also an influence on their Apgar score. Let's Okay, my model actually, when you looked at now the when I was doing my stratifications, when you looked at the gestational age having an influence on birth weights, which may also influence the Apgar score. So it was actually very statistically significant. It means that all newborn with preterms may have a high risk of having a very low Apgar score. So as a conclusions and discussions, so in this cohort stats, we found that low birth weights have actually some of the risk factors, so which may include medical risk factors, multiple birth weights, gestation age. So they are considered to have this a negative impact on the Apgar score at delivery. However, my studies couldn't take the Apgar score at 5 and 10 minutes, so that is one of the limitations. I actually have uh, the Apgar score evaluated at 1 minute, and other studies are actually needed to make sure that we also have other data which can give an idea of this Apgar score at 5 and 10 minutes. As I've said, this was actually a cohort study which could actually take other more data to be evaluated and to have more cohorts in our studies. So these are the few reference I've used which can be used by other colleagues to go through on other studies which actually have provided similar information on these particular topics. So thank you very much.